So once again, we have our questions, which is actually open to all of the speakers. Unless Ahsley gives us a little karaoke, he's got a mic walking around. Dr. Carson does as well. Mary, Gianna, and possibly Megan as well.
Sorry. You did? Are we going to hide this on my white jacket? I won't tip you.
Wait, you know what?
Does it match?
Do you mind me?
No, I don't. Who is that? No. A big deal. Oh.
Oh, hello. Absolutely. Thank you.
Hi.
Thank you.
Yes.
Eye candy.
Okay, Mary, this question must be for you. Are there any non-religious resources for healing from abortion?
Oh, good question. Testing? Yeah, okay. Yes, absolutely. There are. Lots and lots and lots of groups. Non-religious, okay. Sorry, in my head I thought non-Catholic. So there's a group out there called Support After Abortion, and they actually, it's rare, I'll tell you, to have that a non-religious perspective. But certainly, like if you think about, I talked about the triad, grief, sin, and trauma, right? So there are non-religious groups that might address, well, very few, because they don't want to admit, right, that this is something. I mean, the American Psychological Association, I could go into that. It's a whole other discussion. But the grief certainly, right, and the trauma, the sin aspect, right, that's particularly the religious aspect. But it's rare. Support After Abortion, they try to connect people to non-religious resources. And I'm trying to remember the name of what the ministry is, but so I'll just conclude that babbling answer by just saying very few, but there are out there.
I'm going to guess this question might be maybe to start with Dr. Fernandes and Dr. Carson. Megan, I guess you've probably answered this. What is the hardest challenge you've had in defending healthcare and ethics?
I can, hold on, there we go. I guess I can try. I think one of the things, and I alluded to this in my talk, is really being able to translate the truth into secular language. So people are more apt to believe in, for example, the basic principles of Catholic healthcare ethics, if we would share some fundamental foundational values. The challenge then is when people don't believe in anything transcendent, how can you get them to start to gravitate towards the true things that our church teaches about human life and human dignity? And I think one of the ways to do that is through their own experience. You know, John Paul II talked in his philosophy about how we learn about the world is not simply through reasons, there's sort of algorithmic processing, but there's also this ability to grasp the truth through experience. The truth is subjective, it exists outside ourselves, but our experiences can also lead us to very true things. I mean, we just heard a speaker Mary talk about healing ministry of abortion. No one told women who had abortions to have any regret, or that's their experience. And if you didn't know anything else about it, you would look at that experience, you would say there's something true that's being tried to be taught here. And I think that's one way. So I think not having that foundational belief, to answer the question, is the biggest challenge. With other Catholics, I think this is in some ways a greater challenge, because we're all supposed to share certain foundational beliefs. Now, I teach a lot of medical students, and they're not a lot of Catholics in medical school anymore, unfortunately, because they're all the ones that say that they're Catholic, sort of, they try to weed them out. On the front end, yeah, but that does happen, I know, very not nice. But of the ones that are left, that can present a challenge too. And I was talking to a seminarian friend of mine, and I was basically trying to explain, it's hard to teach them about things like the ethical and religious directives when they couldn't name the 7 sacraments. So if there's a catechesis problem with our young Catholics who are entering medicine and they don't understand their own faith, then I think that becomes a challenge to teaching them anything else along the line.
So I'm thinking of a specific patient scenario for me. Patient came to me married, seeking fertility care, hoping to get pregnant, and she was really transparent. She was irreligious. She had, prioritized her career and hadn't really thought about getting pregnant till almost her mid-40s. And she had seen another provider that basically said, hey, you're too old. You're going to have a, disabled child. Really, you need to go through IVF and proceed with with an egg donor because your eggs are too old. You're going to have, a disabled child, and you really need to have them screened. So again, back to eugenics, because we know if in IVF we can screen our kids for all genetic issues, they're never going to have any suffering or challenges in their life, right? Like we can weed out all of that. So essentially, she knew that, I work for my Catholic doctor. That wasn't going to be something that I was going to be promoting or helping to facilitate. But I remember, praying about it, researching it, and ended up presenting her with some published research articles on the mental health effects of children who were conceived with donor gametes, essentially, and the negative impacts on their mental health and the outcomes there, and just said, hey, I wanted to let you know this is a concern. Obviously, you want to start a family, but I think you should be aware of some of the repercussions and the possible effects, essentially. And she did end up proceeding with IVF and using an egg donor. But, I felt like I did my job from an informed consent standpoint. And again, trying to meet that patient where she was, talking about the ERDs or, necessarily the dignity of the person. I did talk about, the process of IVF, creation of multiple embryos, the discarding of those that are screened and not deemed worthy, but really tried to keep it more in kind of medical, secular terms.
Is this thing, hello, testing? I have a question that has been irritating me and bothering me, and I need someone to help me with it. And it's the whole idea of the abortion pills and how basically can't you just go online now, the equivalent of Amazon or whatever, as fast and just, get your pills, and they're having abortions obviously at home, all this stuff, which makes a way for incest, all kinds of things going on, hiding a bunch of stuff. And one thing that bothered me so much was I was doing a fundraiser for a pregnancy resource center recently, and the director said that the girls' houses are becoming tombs to them, that every time they hear a toilet flush or they have these things, they are reminded of this. Now, my question is this: if this is happening almost in secret, almost always in secret, possibly with hemorrhaging, blah blah blah. I don't mean blah blah blah, but just to get to the point faster. How can I help? How can I help when everything can be done? It's as easy as ordering your I get my groceries delivered every week. I haven't been in a grocery store forever. This is a problem. Can you help me with this problem? How do I address it? Nice to meet you. What a question to begin on. Never seen you in my life. Hi.
Hi. So yeah, I'm a PA, Megan Kreft, and one of the services I offer is abortion pill reversal, and that demographic that we're primarily reaching and ministering to are women who are receiving chemical abortions, have taken the first abortion,
Yeah.
the first abortion pill. And so I think kind of based on kind of your experience and your mission and your calling, like stick, obviously what you're doing, you know, reminding folks of the dignity of each human life, both of the child and the mother and the father, but also letting folks know that abortion pill reversal is an option. This is an option.
Yes, but how, I'm sorry, I did not mean to do this, but I'm irritated because it's so accessible. How do we invade such accessibility before? Like, how can we, do you change the messaging? Do you, whatever? And that's what I have to figure this out. It's driving me crazy.
Well, there are
Do you need a mic?
She's got a mic.
Oh, go ahead.
there are people, actually activists, pro-life activists now. I know this does not directly address your question, but there was some activity early on when Walgreens was going to start providing.
Ugh.
Yeah, they were going to start demonstrating at all the Walgreens. So in addition to being at abortion facilities, they're also going to be in front of Walgreens, CVS, all of that. So, and I would say, like, we have all of these laws about, I think it's the, I forget the name of the law. This is not my area of expertise. That's my husband. But the problem with the laws that prevent the I think it's interstate commerce, right? Is that they're not enforced, right? How do you enforce through the U.S. Postal Service?
Sure. That's what I'm saying. Okay, I don't know what
So
to,
prayer, Gianna, prayer. That's
I'm a little intense about it. Sorry.
Could I just say one thing about this is that, and you guys should realize this, that we need to keep, this is why it's so important that you're so well educated at a place like this, is to keep hammering the medical and scientific fact of the humanity of the unborn child from conception. It doesn't matter at what point you think you can murder it, and if it happens in secret, it doesn't make any difference. And honestly, Gianna, like, this is the second time I've heard you speak. One was 2016, years ago. But you are a witness to that truth. It's very, very difficult for the other side to say this is not a person when there is a person right in front of them talking. And that's why I think the abortion pill actually has this second danger beyond the medical danger, which is if we grasp truth through experience, the abortion pill done in secret tries to hide or snuff out that experience of the humanity of the unborn child. But the more visible you are, the better it is as well. And I would just encourage that. Tell those stories. Repeat Gianna's story over and over again, because people need to be reminded that this is a human person. You're living proof of it.
I have something to add more for the medical providers out there. I remember talking to a fellow Catholic provider, physician, family med OB physician, and about abortion pill reversal, which we use progesterone to counter the effects of mifepristone, the first abortion pill. And she was like, hey, there was a study where they were looking at its efficacy and safety, and they stopped the study due to safety concerns. So this is a fellow Catholic. So I remember being like, what? So I dug into the research, and if you actually look at it, there were concerns about the safety of women who were hemorrhaging in the study. The group that was hemorrhaging were the ones who had taken the mifepristone and proceeded with the chemical abortion and did not get the progesterone. So how it is presented is very deceptive. And so even Catholic clinicians would say this isn't evidence-based, it's unsafe. The study was halted due to safety concerns. If you actually read the study, and I don't remember when it was published or who the collaborating authors were, the details are really important there.
Thank you for that. Thanks.
Megan, this question looks like it's for you. Did Providence Hospital ever experience any repercussions for what happened to you or change their employee contract?
Yeah, that's a good question. That's a question I have too. So not that I'm aware of. Again, a lot of things can happen behind the scenes. As I mentioned, I alerted our diocese and spoke extensively, kind of step by step. Everything I shared with you, all the documents, I have many more documents, all of that was shared with the chancellor of our diocese, and I hope was passed along to our bishop. To my knowledge, they're still considered a Catholic hospital. They still had their identity repeatedly conferred, but behind the scenes, I don't know what change or repercussions were had, and I don't know what their most updated employment contract looks like. I'm really curious. It's something I've talked to my husband about. Like, do you think they still have Section 3.5 in that employment contract? I'm not sure. But my hope and prayer for the organization, is one of that they would rise to the challenge of being a phenomenal Catholic pro-life health system. I don't want them burned into the ground. I want them to be who they say they are. Yeah, I want them to be who they say they are, right? About being authentic and true to their Catholic identity and mission. So that is my hope and my prayer.
Gianna, we have a lot of future healthcare professionals, therapists, nursing, etc. What attitude, from your perspective, is most helpful when they encounter somebody with CP in the clinic? Sympathy, frustration, empathy. Can you provide some guidance?
It depends on, are we talking about children or adults or
Both?
Well, I can tell you one thing, because I'm going to tell you. Anyway, I was actually just having a really honest conversation with someone about this very thing, about being honest. I think there is a balance with honesty, right? You don't want to just run in and say everything you think ever, no matter the context. That would not be wise. But there is a tendency by well-meaning people to, as an adult with CP, to infantilize me, to treat me like I am 6. So I let them know real quick, that's not going to work. And then they get all offended. It's usually women. They get all huffy and offended and say to me, "You are fiercely independent." And then I say, "I'm sorry I offended you." "You didn't offend me," which is always convincing. And I call them on their BS and I gently say, "Thank you so much for wanting to help me, but sometimes the overhelping is interrupting a process in my brain. And if you will hear why, it's not that I don't want help. So if I don't ask you for help, now if I happen to miss that there's a Mack truck coming to hit me and I am distracted over here trying to balance, please let me know. But if I don't ask for your arm," and also it's irritating when people are like over touching you. And not in a creepy way, but they're being like, I am not the paralytic. Does that make sense? So I'm telling you, what I hate is being treated like I am 6 and having to and also, I don't know, that's the most irritating thing. It's nice to be treated, most of my friends and the people I'm around, they say they forget that I am disabled. This is not the topic of conversation. This is and we laugh. And we laugh even when I fall. And the last thing I'll say is, for example, there's an Italian family that's adopted me, a widow's family. And the last time I was there, just in August for one of the sisters' wedding, another wedding, but it was beautiful. I went to pray over the houses, and my foot got caught in some of the weeds. I mean, the houses are from the 1700s, and they're crumbling, and it's fabulous, and I want to live in them. And my foot got caught, and I slammed into the ground. And my Italian sister was like, no, it's like, stop. And I go, no, I'm okay. Then the other foot, I got caught again, and I slammed into the ground. Stop, sister, stop. No. I said, no, I'm okay. I'm determined. And I got up, and I ran down the driveway to pray like I intended to. And I just say all that to say, even in that, there's life. So be honest, have the honest conversations, and then let an adult be an adult. And I would also say encourage the parents to gently guide the children to not think of themselves as a victim and defined by their disability, but take that disability by the grace of God and change things with it.
Thank you.
Thank you.
I'm going to give you all, 5 of you, just a second to think. This is going to be the last question. We'll give you each a minute or so. Last bit of most important advice, that this is the future of our healthcare, who's sitting out in this audience. What advice do you give to them? Whoever wants to start. Mary.
I'll go first because I cheated and I saw it on the screen before you read the question. I would suggest be ready for the truth to be the truth that you know of what a human person is. Be ready for that to be challenged. Be ready. Be ready emotionally, psychologically, clinically, academically, intellectually. Just be ready because it will be challenged. It's challenged. I mean, we know this is true. We believe it by the gift of faith, but we also know, right? When they changed the embryology textbooks, I don't know, forget what it was, 30, 40 years ago, right? Like, why? You're going backwards, right? We know this is true. We know when life begins. We know that. And it's going to be challenged all the time. I would just say be ready to protect and promote the truth about the human person.
Hear me? Oh, yeah, there we go. Okay. So I would say one thing that Dr. Fernandes talked about in his talk essentially is seeing Christ in each of our patients. And you're going to have exhausting days. You're going to have days where you're having difficult, annoying conversations with patients where you're fed up. You'll see someone on your schedule and you'll be like, dang, not again. I'm already overwhelmed, right? Like, this is just the reality of it, right? And so I think that that is so important to keep that at the center. Like, I am serving Christ. I'm going to see Christ in this individual no matter what they bring to that visit or that encounter. And I know personally we experienced this with shortly after we had our first, he was a horrible sleeper. Our now 7-year-old was a horrid sleeper. And, I was kind of at a loss. We were trying to do sleep training. It was just a nightmare. Weren't getting any sleep. And I had reached out to our pediatrician's office. This is just an example, for help. And I had gotten a return voice message, a call that I had missed from one of their nurses. And she thought she had hung up the phone, but she hadn't. And she went on and on about like how irresponsible we were and how, she's probably co-sleeping in the bed with him right now. And isn't she a PA? And all these things.
Yes.
Is going. And I remember thinking, I'm so glad this happened to us and not somebody else. But it's one of those things that can be really easy. And I saw this working when I was actually working in a brick and mortar clinic for the clinicians to kind of, gossip about their patients and talk about, can you believe what so-and-so said, or they're not taking care of themselves, or they're whatever. And so I would just say it's so important, I think, to focus on the vocational calling, the calling to participate in Christ's healing ministry, and you will encounter a lot of suffering, right? And so I think that that's really important. So I know my story with the poor sleeping baby. He actually is a good sleeper now, 7 years later.
I would hope so.
all 3 of our kids were horrid sleepers when they were little, and it does pass. That does pass. But essentially, be on guard for that. It can be really tempting, especially when you're kind of burnt out, tired. But you never know. God hears all of this, right? Like, he sees all of this, he hears all of it, and you could really harm a patient too if they're privy to that. So I would say be really cautious on not engaging in that and focused on the dignity of each individual before you.
I guess I would kind of repeat an iteration of what I had said in my talk, which is between good and evil, there really is no neutral place to stand. And so please don't think that when you go out in the healthcare professions that you will be able to keep your head low and please don't want to do that. You are the light of Jesus Christ in every single action in the clinic and in front of your patients, and when you teach other people about how to do your craft. And so it's really a binary choice whether you're going to move toward the light or towards the darkness, or at the very least, if you don't like to move, at least be a rock, as I said, at least be this stone. There's this great quote from Ovid, the poet, that my dad knew in Latin, and he taught me. Of course, I don't know the Latin anymore, but the English I remember, and that is a stone. Water hollows out a stone, not by force, but by persistence. And I want you to think about that. All you have to do, at the very least, is stay in the game as a Catholic or Christian healthcare professional. Stay where you are. And drip, 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 your presence over time will break down any wall and any barrier that you come across. So don't give up. Don't be neutral, and be persistent.
I like that.
I'll send you the Latin.
I would just say, I'm no medical professional, but empathy, we hear that all the time now. I think it sometimes loses its meaning when we hear something so often, but I'll give you a quick example. Well, I would also say that if you could embrace the suffering that will naturally come into your lives and remember the courage of some of your patients and use that, and I would try to know what it would be like to slam into your kitchen floor or like challenge yourself with rock climbing or like threatening injuries in a way. No, I'm not like encouraging horrible things, doctor. But like how amazing if you're intentionally challenging yourself and you fail and you start to get pissed, like you start to feel real human emotions. You know what that feels like. That is going to change how you practice. And my example, sorry, I'm trying to keep it under a minute, and now I'm in 5 minutes. But I was 10 years old, and I was one of the first candidates for the dorsal rhizotomy, the spine surgery, to help people with CP. And Dr. Peacock and the guy that invented it, whomever, awesome, Callahan, I think. The two doctors were fighting at the door, disagreeing on whether I should have this surgery. And they looked at my adoptive mother and said, "Do you want us to take her in?" If they spliced too many spastic nerves on my spine, I would obviously never walk again. If they spliced just the right amount, I would walk so much better. And it was a 1.5-year recovery. Penny took me through. The one that taught me to walk the first time taught me again the second time. But in that hospital, in the week of the surgery, there was a nurse. And I know that most nurses are amazing and some are awful. And I had been allergic to the mask, the tape that they used at the time. I don't know what they do now. But I was allergic and my face swelled up. Just 10 years old, and I hadn't seen myself. And this nurse walked in when I was laying there in the bed at 10, and she goes, "Do you want to see your face?" And she flashed the mirror in front of my face. I'll tell you that because I never forgot that, but I also never forgot what happened next. There was another nurse that was a Christian. And she knew I sang. And she came in and brought her husband to play the guitar, and they sang Christian songs by my bed. And they covered over the wound that the previous nurse tried to inflict. And so be the second nurse, not the first.
Great pieces of advice. I'd like to follow up on what Megan had to say. I shared during my talk, paraphrasing the name of my patient Annie, the HIV infected, hepatitis C infected, long-standing drug-using patient who was really hard to care for. And every time my staff would see that she was on our clinic schedule, they'd take a heavy sigh, gird their loins, get ready for the day, and it was going to be a ride. And I tried hard to treat her with dignity and respect, but it was not easy. And when she said to me that line about, I know I make you crazy, Dr. Carson, I know that we've got a contentious relationship, whatever, but at least you don't treat me like a piece of garbage and you don't see me that way. That struck me so powerfully that I really started to pray regularly for the ability of what Megan said, to see Christ in every one of my patients. So asking for that grace. I think another thing that can help with that, I highly encourage you, if you've never read or seen C.S. Lewis's essay, The Weight of Glory, it's a very powerful essay. It's not very long. You can find it online. And in that, he describes how we are to relate to one another because of the fact that we are immortal. And he talks about there are no mere mortals that we eat with, drink with, take care of, snub, say mean things to, whatever, that we are dealing with immortal beings. And so everything that we have in this life is really a transient blip. So our even the cares in that clinic that day, the tiredness, the frustrations, what we're thinking about at the end of the day, it's a blip in the context of that immortal soul you're dealing with. And he even goes so far in the last lines of that to say, in relation to what an immortal soul is, institutions, nations, civilizations are but the life of a gnat compared to that immortal soul that you're standing. It has immeasurably more worth. And so trying to kind of keep that in mind regularly in the people that we deal with, I think really helps to put everything else in much better perspective.
I'm now going to call Dr. Lauren Emmel up to lead us in our final prayer, and we will end for the day.
Please join me in prayer. This is a prayer of St. Teresa of Avila. In the name of the Father, and the Son, and the Holy Spirit, amen. Christ has no body but yours, no hands, no feet on earth but yours. Yours are the eyes with which he looks compassion on this world. Yours are the feet with which he walks to do good. Yours are the hands with which he blesses all the world. Yours are the hands, yours are the feet, yours are the eyes, you are his body. Christ has no body now but yours, no hands, no feet on earth but yours. Yours are the eyes with which he looks compassion on this world. Christ has no body now on earth but yours. In the name of the Father, and of the Son, and of the Holy Spirit, amen.
So again, Gianna will be out here on a,
Can I just stay here?
sure?
Okay, I'm just going to stay.
Okay, Gianna will be up here for anybody who wants to come up and speak to her at the conclusion of the conference. Again, tomorrow morning, 7:30 Mass, optional at Our Lady of the Word Chapel. Check in at the Casey Center foyer, and then we'll begin with our first breakout sessions at 8:30. Please help me give a round of applause to our outstanding 5 speakers.